Welcome to the Ken Education YouTube channel. So in this video you will see about the part 1 pulse. Okay, so without delay we will start the class. So pulse is a wave of blood created by the contraction of the left ventricle. Okay, so here what happens, so this is a right auricle, this is a left auricle, this is a right ventricle, this one is left ventricle. So from the left ventricle what it will goes, from the left ventricle aorta will goes, isn't it? So whenever there is a pumping of the blood from the left ventricle, that exerts some force on the blood vessel, so that one will be called as BP. But after the exertion, the wave that will goes all the way from the proximal arterial to the peripheral arterial, that is that wave like will be called as pulse. Okay, yes, the pulse is a wave of the blood created by the contraction of the left ventricle of the blood. I hope you understood this point. Next, each time the heart contracts to the force blood into the aorta, the arterial walls expands, as I said. The expansion of the arterial walls due to increase in the pressure, so that is nothing but what, the pulse, isn't it? Next, so what is the definition of the pulse? Pulse is a palpable, so we can palpate it by assessing the radial pulse or the different sides of the pulse, and a rhythmic expansion of the artery produced by the stroke volume. So stroke volume, so there is a content, there is a lot of in the left ventricle. Suppose there is a 120 ml blood is there, 120 ml blood is there. So due to the contraction of the ventricle, so the amount of the blood is ejected out from the one contraction of left ventricle, that is about 70 ml will goes out. So what the amount of ml that is ejected out per contraction, that is nothing but a stroke volume. Okay, so what was the remaining? 70 was goes out. What will be the remaining? It's totally 120 ml. 70 ml is ejected out, that is called stroke volume. Remaining in the left ventricle is, that is 50 ml. Okay, so this is the remaining volume of the blood that is in the left ventricle per contraction, not for per minute. Okay, yes, volume of the stroke volume of the left ventricle during systole. Systole means what? Systole means contraction. Clear? Okay, so pulse reflects the cardiac output also and arterial compliance also. So cardiac output means that is per minute. You should think this one is per minute. Per minute, okay, per contraction 70 ml output will be there. 70 ml output, that one will be called a stroke volume. But how many beats will be there for minute? That is about 72 beats per minute, isn't it? Then if we want to see the cardiac output in a minute, then how much it will be? It will be around 4900 something, isn't it? So totally for per minute 5 liters of the blood will eject out. That is nothing but cardiac output. I hope you understood this one. Okay, next, by counting the each pulsation of the arterial wall we can determine the pulse rate, as we know. Yes, by counting, by palpating it, we can understand the pulse rate, isn't it? Next, physiology and regulation of the pulse. How this pulse is created, how what are all the physiological actions that is done by the brain and also from the other than the brain. Okay, first, the quantity of the blood which is forced out or ejected out of the left ventricle with each contraction is called stroke volume. This is the definition of the stroke volume. Clear? What is the definition of cardiac output? Cardiac output is a per minute, isn't it? It's a per minute. It is the amount of the blood is pumped per minute. Next, what was the note thing we need to look for? Normal cardiac output in healthy adult must be 3.5 liter per minute to 8 liter per minute. So average, if they ask, you should say that is 5 liters per minute. Average. This is average. This is average and this is the range. Clear? Okay. Pulse wave travels faster than blood flow, of course. So sudden, okay, if I say this is the aortic arch of aorta and this is the peripheral radial artery, which is coming from the arch of aorta branches itself, right? So once if the force which is applied by the blood after the systole, that time, so this blood flow will be remaining here only, but that contraction will expand the wave, that will goes very faster. So still the blood is coming, but waves will goes moves very faster. That's what they are saying. Pulse wave is faster, travels faster than blood flow. I hope you understood this one also. So already I said the formula, that is cardiac output is equal to stroke volume into heart rate, isn't it? So stroke volume is 70 ml, as I said. So suppose if you take 70 beats per minute, okay, per minute, right? This is per contraction. Stroke volume is per contraction. uh, Heart rate is 70 beats per, this is frequency, this is volume. Clear? Okay. Frequency means how many times, volume means how much. Okay. So totally around 5000 means 5000 ml means, that is 5 liter means 4.9 liter per minute if they calculate like this. Clear? Okay. So next, cardiac output. So from the cardiac output, how it will changes, increases during the physical activity. If they are doing any exercise, that time it will increases. Or if they are sleeping, that time cardiac output will decreases somewhat less than less than 4 liter. Okay, if they are exercising, that time it will goes up to 8 liters or 10 liters per minute. Okay, so athletics, they may have more. Okay, next. So it varies depending on the body size and also metabolic needs. I will say that what is body needs and metabolic needs. So body needs, like a stout person, or we can say that is a tall person or a slender person, they may have more pulse rate. Pulse rate is nothing but what you can think, that is heart rate. Okay, yes. Next, pulse is regulated by the autonomic nervous system. So in the autonomic nervous system, see, in the autonomic nervous system we will see the cyanoatrial. In that cyanoatrial node will do the function for the heart rate. Okay, cyanoatrial node is the function. So very importantly, right branch of the coronary artery will supply the blood supply for the cyanoatrial node. If there is a lack of blood supply to the cyanoatrial node, that will not do the function properly. Thereby there is a decrease in the frequency. There is a decrease in the frequency, means that is decrease in the pulse rate. Okay, so that's one point I need to add, that's why I added here. Okay, this is a pacemaker of the heart, where it will gives the 60 to 100 beats per minute. Okay, yes. Next, parasympathetic stimulation. See, there are sympathetic and also parasympathetic. What is the sympathetic will do? It will increases the heart rate, increases the force of contraction. Okay, so increases the, you can think, that is pulse rate itself. Parasympathetic, it is due to the vagal stimulation. It is due to the vagal stimulation, or it is due to the, that's vagal stimulation means cranial nerve 10th. Clear? So due to this, it may when it is stimulated, that time decreased heart rate will occurs. What occurs? Decreased heart rate. Okay, so here only it is mentioned, sympathetic increases the heart rate and force of contraction, and parasympathetic stimulation will decreases the heart rate. Okay, yes. Next, what are the other physiological action? Chemical. Chemical control here very importantly CO2. So if the carbon dioxide retain in the body, or if the oxygen is less in the body, or if the pH level is less, that means acidosis. Whenever there is a acidosis, that time what happens, there is a increased in the heart rate, pulse rate. Clear? Okay. So if the carbon dioxide is less and oxygen is more, or if the pH level is high, that time this one will be called as alkalosis. When there is a alkalosis, that time decreased in pulse rate. Okay, I hope you understood this one. So this is about the gaseous chemical changes control. Coming to the hormonal, thyroxine and adrenaline or epinephrine you can say. Thyroxine and adrenaline, these two will do the increase in pulse rate. Increase CO2 will increase the pulse rate. I hope you understood this one. Next, baroreceptors where it will controls the BP. Sir, why you are telling about the BP? Actually, whenever there is a decreased BP, there is a vice versa increased pulse rate to compensate the BP. Okay, so heart is okay. For overall the body, BP is low, that means hypotension is there. Hypotension is there. Whenever there is a hypotension, there is a decreased perfusion to the organ. So that in order to compensate, in order to supply the blood, heart will do the regulation, compensatory regulation, that is increased heart rate. It is none other than nothing but increased pulse rate itself. Okay, I hope you understood this one. Okay, what are the baroreceptors are that will maintains the BP? Okay, that is carotid sinuses. So here there is a carotid sinuses. If you do the massage of the carotid sinuses, what happens, there is a reflex bradycardia. Sir, why the reflex bradycardia occurs? Because whenever there is a stimulation, that time it will stimulate the glossopharyngeal nerve. Okay, so due to the stimulation of the glossopharyngeal nerve, that will makes the bradycardia. So carotid sinus, glossopharyngeal nerve. Coming to the aortic, this one aortic arch receptor. See here, carotid sinuses will stimulate the cranial nerve ninth, that is nothing but glossopharyngeal nerve. Next, aortic arch receptors are here, that will makes the vagal nerve, that is cranial nerve 10th. Okay, so whenever there is a stimulated, what I am telling you will understand easily. First, whenever there is a increased BP, these receptors are there na, these receptors. So increased BP will makes the will makes what, increased stimulation for the glossopharyngeal nerve in the carotid sinuses. Increased BP will makes the increased carotid sinus stimulation, that is nothing but increased vagus nerve. So that whenever there is increased vagus nerve, that time there is a decreased pulse rate. Here also there is a decreased pulse rate. Clear? Okay. Next, pulse rate. What is the meaning of pulse rate? Number of the pulsations felt over the peripheral artery or heard over the apex of the artery. Okay, so there is a apex of the artery. At the apex of the artery, this is the apex of the artery. Okay, in this apex of the artery, if you are examining the apical pulse, sorry, okay, if you are doing the apical pulse, that time it will show you the pulse rate. Okay, how many beats, isn't it? Apical pulse is a most accurate pulse than the peripheral pulse. Okay, suppose radial pulse will gives you 100 beats per minute and apical pulse may give you 120 beats per minute, then there is a difference in the radial pulse and also there is a difference in apical pulse. Sir, then which is the correct, which is the most accurate? That is apical pulse is the most accurate. Sir, then what is this difference will be called? That one will be called as pulse deficit. Pulse deficit. Sir, what is the meaning of pulse deficit? Apical pulse rate minus apical pulse rate minus radial pulse rate. That's it. This is nothing but what? Pulse deficit. Radial pulse is not in the center, that is in the peripheral, away from the center. Apical is center. Okay, I hope you understood this one. Next, factors affecting the pulse. Pulse rate is expressed beats per minute. Everybody know it varies according to the several factors. First one is age. Age as age increases, the pulse rate decreases. Okay, so that means newborn baby, when they born, that time there is a very importantly 120 to 160 beats per minute will be there. In 1 year 110 to 120 beats per minute. 5 to 8 years 95 to 100 beats per minute. Adult male 70 to 80 beats per minute. Adult female somewhat different will be there. Athletics there have 45 to 50 beats per minute. Okay, so when they are in resting, very importantly, they may confuse you like this. Okay, during resting, that time they may have 45 to 60 beats per minute. Okay, next, gender, that is normal. This is normal for them, not abnormal. Okay, but for the others than the athletes, less than 60 beats per minute is bradycardia. What is meant by bradycardia? That means decreased heart rate. Good. Next, gender. In a gender, after puberty, average male pulse rate is slightly lower. That means females will have more pulse rate than males in the after puberty. Okay, not before puberty. Okay, next, exercise. It will also increases with activity. Fever, that will also makes the increase in the pulse rate. Fever also makes the pulse rate to be increased. Increased metabolic rate also will occurs in the fever. Okay, next, in the fever, response to the lowered blood pressure. Due to the lowered blood pressure, okay, there is an increase in pulse rate. You think like that. Clear? Peripheral vasodilation, this is hypotension. So whenever there is a peripheral vasodilation, hypotension occurs. What is the meaning of hypotension? Decreased BP associated with elevated body temperature. Clear? Okay, next, what are the medications that may vary the pulse rate? That is some medications like cardiotonics like digitalis, which will increase the force of contraction. Okay, force of contraction is different, heart rate is different, don't confuse. Digitalis, when it will be given, it will be given whenever the patient, cardiac patient is there. Okay, some that will, what it will do, it will do the decreases the heart rate. Okay, some medications that increases the pulse rate. Which one will increase? Epinephrine, where you will give in the shock. Clear? Anaphylactic shock. Next, hypovolemia. I hope you understood from the medication. Next, hypovolemia also changes the PR level, that means pulse rate level. Loss of the blood from the vascular system, that time it will increases the heart rate. Causes increase in pulse rate due to the adjustment of the heart rate, as I said. Okay, so there is a compensation of the blood pressure. Next, seventh one. So what they are saying, stress increases whenever the person is in stress, that time heart rate will be very high. Whenever sometimes they may get anxiety, so much anxiety, or if they are phobia, not phobia, so much anxiety if it is there, that time they will get palpitation also. What is the palpitation? Palpitation means that sound that can be heard, heart sound that can be heard for the patient, due to the sympathetic nervous system stimulation. Why it is happening? Sympathetic stimulation. Clear? Okay, if you make the change of the position regularly, that time also there is a vary in the pulse rate. clear. Pathology, heart conditions like aortic regurgitation, okay, and some other conditions that may like myocardial infarction, hypertension. These are also cardiac problems itself, vascular system problems. Conditions impairing the oxygen also, okay. Hypoxia, hypoxemia may also make the pulse rate to be increased. Resting pulse rate means when the patient is taking rest, that time also pulse rate will increases. That is due to the condition, that is due to the certain disease condition. So if the patient is having fever and if they are sleeping, then sir, what sir, if they are sleeping, why they are getting increase in pulse rate even though they are not exercise? Because in order to destroy the microorganisms, pulse rate will increases during the rest also. That is nothing but resting pulse rate variation, okay. Next, pain. So pain also will increases the pulse rate. Body built and size, that as I said, tall people, slender person, or a stout means very fatty, very fatty, or so much big person, okay. So they will get a high pulse rate, because in order to compensate and in order to reach the blood to everywhere. I hope understand, everyone has understand the class. In the next class we will do the pulse 2 when it comes. Thank you for listening the class.